My name is Joseph Murray, and I'm a professor of medicine and a consultant in gastroenterology at Mayo Clinic in Rochester, Minnesota. I've been asked by the editors of Clinical Gastroenterology and Hepatology to discuss our paper that will be appearing shortly in the print edition of Clinical Gastroenterology and Hepatology. Our work describes the accumulation of heavy metals in people on a gluten-free diet. The basis for this work started many years ago. Initially, a project designed by Jay Everhart and colleagues at the NIDDK and myself, we utilized the NHANES survey to identify those individuals who have celiac disease by testing blood samples, and we also identified those who were adhering to a gluten-free diet without a diagnosis of celiac disease. We reported the initial findings in gastroenterology and other journals. And once we had published what was arguably the most reliable picture of celiac disease occurrence in the US, we then decided to look at consequences of avoiding gluten. In particular, there have been some concerns that certain foodstuffs, particularly rice and perhaps fish, naturally may contain higher levels of certain heavy metals. And these are foods often eaten by people on a gluten-free diet. And separate from our testing for celiac disease in the participants of the NHANES survey, there were also testing of many of these subjects for heavy metals, particularly urinary arsenic and blood levels of mercury, cadmium, and lead. The methodology needs to be reviewed. While the survey is regarded as one of the most rigorous representations of the US population, because of the planned oversampling of particular populations, analysis needs to be done taking account of these sample weights. So undertaking a study using NHANES requires particular analytical rigor given the complex stratified sampling strategy of the survey. By doing so, we were able to carefully identify associations between those who are adhering to a gluten-free diet and heavy metal levels. In this study, in CGH, we reported that those individuals who were adhering to a gluten-free diet have significantly higher levels of heavy metals, particularly arsenic in the urine and mercury in the blood. In this study, we found an excess of arsenic in those adhering to a gluten-free diet. And while these increased levels of arsenic did not reach the toxic threshold, or what we consider to be toxic threshold, it does raise the possibility of bioaccumulation. Because these heavy metals, if the patient is continued to be exposed to high levels in their intake, they will have bioaccumulation over time. In addition to the arsenic, we found that blood levels of mercury and lead were also increased in patients on a gluten-free diet. It should be pointed out that most of those on a gluten-free diet were on it without a diagnosis of celiac disease. It also begs the question, where do these heavy metals come from? It's likely that these come from certain foodstuffs. For example, arsenic can accumulate in rice because of groundwater contamination of arsenic, and mercury is common in fish. And it appears that individuals avoiding gluten may also have increased fish intake, perhaps with the intent of eating a healthy diet. Our findings should certainly raise a red flag that perhaps people should not go on a gluten-free diet without good reason. Either a diagnosis of celiac disease or at least some determination that significant benefit will accrue to the patient by avoiding gluten, and certainly that there may be the case in patients with non-celiac gluten sensitivity. Our study was not designed to capture the reasons why people were avoiding gluten without a diagnosis of celiac disease. So what do these findings mean for our field? First, of course, we need further studies to address whether continued bioaccumulation occurs, in addition to identify if there are any biological consequences of such accumulation. Certainly, we need more research to understand why people are adopting a gluten-free diet and to conclusively identify whether any benefits or harm are accruing to people who are avoiding gluten. Continued long-term monitoring of individuals adhering to a gluten-free diet for heavy metal accumulation may be valuable, especially in those who are more vulnerable, such as the younger individuals, where bioaccumulation of heavy metals may have greater long-term consequences. Finally, this work should not be a reason for alarm among patients who are following a strict gluten-free diet. Perhaps, however, being aware of sources of heavy metals and also perhaps raises the public health issue to ensure that purveyors of such foodstuffs take account of excess heavy metal levels that may accumulate in their food. Thank you for your attention.